I'm here with Bonny Specker, epidemiologist from South Dakota State University, who is going to give us an update today on what has been happening with COVID-19 in our region, in the state, across the United States, and in the world. And before that, she's going to talk to us about Epidemiology 101, rates and trends. Bonny, what are rates and trends and what has been happening?
Well, I'd like to start off with just some information on rates because there seems to be a lot of confusion. A lot of people don't understand why we put numbers on a per 1,000 population or 100,000 population basis. And I thought I would just go over that. We did this in a previous one, but I've added a couple other things and I've updated some of it. But here we have 4 people, and I'm talking about counties right now because later on I want to go over the rankings for the top counties with the 10 most populous cities and talk about some rates there. But if we have 2 counties, County A and County B, and both of these counties have 4 sick people, say 4 people with COVID, it's really hard to say anything about those 2 counties unless we knew how many people were actually in the counties. So in this example, County A has only maybe 10 people, whereas County B would have 100 people. And you can just see looking at this that County A is going to be much more affected by these people being sick than County B is because it's a much larger percent of their population that's sick than what you see in County B. So it's the exact same numbers of cases, both of them. There's 4 people that are sick, but the rate in County A is going to be much larger. It's going to be 4 divided by 10, the population of that county. Whereas in County B, it's going to be 4 divided by 100. So it's the difference between 40% and 4%. Which is a pretty big difference, even though the number of cases are exactly the same. And here are some examples, and I've drawn out these states. This is North Dakota, South Dakota, and Minnesota. And people always say, oh, Minnesota has so many more cases than South Dakota. Of course they have more cases. They have a lot bigger population size. Here you have in South Dakota, this is as of yesterday, the numbers, we have close to 86,000 cases. North Dakota has 83,000 cases. Minnesota does have a lot more cases. They have 300 and almost 51,000. But if you look at it by rates, and what we did is we just took this number divided by the population of Minnesota, this number divided by the population of South Dakota, this number divided by the population of North Dakota. Now we have these numbers, and these are the number of cases per 100,000 people. So you can see from these numbers that it isn't North Dakota that has a problem. It's really, it's not Minnesota that has the problem, it's North Dakota. North Dakota has the highest rate of cases than of the 3 states. And Minnesota, even though they had this many cases, they have a much lower rate. So this is giving us information on which state is having the highest risk of having the disease. But if I'm a hospital administrator, and I need to know how many beds I'm going to need to have, this is the number I'm more interested in, right? I'm going to need more beds in Minnesota than I will in South Dakota, but the risk of coming down with this disease is higher in South Dakota than it is in Minnesota. So you look at numbers and rates for different reasons. That, what I showed you previously were the actual cases. This is deaths, and you can see here that Minnesota has almost had 4 times the number of deaths as South Dakota, but we have almost double the death rate of Minnesota when you adjust for these differences in population size. And some people have said, well, why don't you just give the population size and the cases and let people, figure this out, like see it on their own. So this is what a table like that would look like. Here we have just the 5 most populous cities, and we have the total number of cases here for each of those counties. This is as of yesterday's um, update. And then here we have the population for those different counties. So we could just give people this information and we can say, okay, there's the information. Now you have to figure out what it means. It's a very burdensome way of looking at numbers to try to comprehend how does this compare to this by looking just straight at the numbers. So what we do is we just divide this divided by this, and that's what you come up with, 0.07327. So these rates let us compare these populations of different sizes with a smaller number. But even this is confusing to people because it's like 0.07327, like that's what does that mean? Well, I can simply multiply this number by 100,000 and come up with this. And that's what a lot of people, a lot of the websites that are tracking COVID are using, a rate per 100,000. So you see a lot of numbers for total cases over this pandemic in this range. So this is the Brookings versus Minnehaha. So you can see that we've had one of the lowest rates here. Now, there's nothing magical about this 100,000. It can be anything. We can do it as a rate per 100. And so we just take, go over 2 here, and then we'd have these kind of numbers. And this is the same as a percent, right? Some number out of 100 is a percent. So in Brookings County, 7% of the population has had COVID compared to 11% in Minnehaha. Or you could say 7,000 out of 100,000. So it's just a way of making these, adjusting for the population differences, and then having one number that you can look at when you're comparing it to other populations. So that's why we do rates, and I just want to talk about some trends. This is cumulative cases per 100,000 population. So all of these numbers have been adjusted for the different population sizes because we don't want to, as I just said, we don't want to compare like Minnehaha case numbers to Brookings case numbers because they have such a larger population. It's going to be a lot larger. But what we want to know is what's the rate, like how many per population. And this is what you get. Here we have back in April, this increase in cases, and then another little bump here. This was the outbreak at Smithfield. And then this is when they went and screened all of the Smithfield families and friends, acquaintances. Here in Beadle County, people will remember there was an outbreak there at one of the local churches. So we have this big increase here. And these are cumulative cases. So this is the total number of cases over this period of time. We have this blue line going down through here because there were no data posted on Thanksgiving. So that data is missing. But you can see here, Brookings, they passed the ordinance back in early September. And at that time, Brookings is this yellow line. At that time, we were about 5th, right in the middle of the 10 counties in terms of total cases. So the mandate passes here, and people have said, oh, but it didn't obviously work because you still had cases afterwards. And you can see that we did. This line is going up, which means there's more cases being added to it. If it had completely stopped it, we would just be flat. But it didn't. But it did slow it down compared to what was going on in these other counties. If you look at Cottington County, for example, this white line, we were having increases at the same rate as Cottington County. These two, the blue line and the yellow line, are very parallel right here, going up together. Brookings slows down and Cottington continues to increase to where now they're the fourth highest county, whereas Brookings slowed down. And you can see this blue one, Davison County's past them. They're really picking up here. The green one, Lawrence County, it starts picking up as well, whereas Brookings stays pretty low. And you have a lot of these counties that were lower than Brookings before the mask mandate that have now surpassed it. So that out here, we are now have the lowest cumulative number of cases per population size of all top 10 counties. And here I've zoomed into that a little bit more, just showing you that what you're interested in is the slope of this line. Is it steep, like right here, or is it flatter? The flatter one's saying there's very small increases. The steeper this is, the larger the increase. There have been some of these counties that have implemented some sort of mask mandate resolution recommendations, and they are the ones that are in solid lines. So like Davison just implemented something back in here, and most of them are around November 17th, the middle of November, when these cases were really going up. Now this is really complicated, but it's the exact same thing, but here it is not cumulative. So these are the number of cases, the average number of cases per day over the last 7 days, adjusted for population size. So take out the population effect, and we can look at what's happening in all these counties. You could, I mean, the first thing you see is it's highly variable. It's all over the place. You know, some counties are having outbreaks, other ones aren't. Again, you see this big peak in Davison. That's why that slope of the line was so steep in the previous slide. But you can see back here around the time of the mask mandate how the number of cases per day in Brookings decreased for a while. It came back up, but it's not going up. You're not having as many as these other counties are. So yes, we do still have cases, and we did increase, but we did not increase anywhere near the level that the other counties increased. And here is how this is summarized. This is the new, out of the New York Times. This is accessible to everyone. You don't need a subscription. And you can look at all counties in South Dakota, not just these. But this is as of yesterday, we were ranked the lowest of these 10 counties in the number of cases per day over the last 7 days. We have the lowest rate. Yankton right now has the highest. If you look at total cases, this is from the beginning of the pandemic. We are also the lowest. We have 7,000 per 100,000. The highest being Beetle County, that has close to 13,000. And then they also do the same thing for total deaths. And this is the first week that we've actually moved up to having the lowest death rate. I think the last couple weeks we've looked at this, we've been second or third, but we have now come out with having the lowest with a 51 per 100,000 population. Yankton has been in that #1 spot for a while. So that's a good, we just need to keep in that #1 spot. I'm very competitive. I like it when we stay in that #1 spot. So in summary, with these trends and rates, I just think it's important for people to realize that raw numbers are hard to compare between groups of different sizes. And rates are used in epidemiology and a lot of other fields when you hear like per capita, that is adjusting for population size. And there's nothing magical about it. I mean, all of us in middle school learned all about common denominators, and that's all we're doing is making a common denominator. And expressing these COVID cases and deaths per population size is letting you compare a variety of populations across the common denominator. So it's just making things doable. So that's the summary.